I'm Fernando Catalina, and I want to thank Laura and Kate for inviting me to share with you my experiences over the past year. As a pediatrician, the COVID pandemic has presented significant challenges. Early on in the pandemic, there were significant unknowns, and those of us in the medical community prepared as best as we could. Through my involvement in hospital administration, I participated in discussions and planning to maximize the hospital's capacity to care for an expected surge of patients sick with COVID-19. The hospital's operating rooms were largely unused, and we reassigned ventilators from unused operating rooms to make ICU beds out of regular hospital rooms. We were still concerned that the number of patients who needed ventilators to survive would exceed the number of ventilated hospital beds, so we approved the ranking system to help decide who gets a ventilator and who doesn't. Should age play a role? Does a previously healthy person get a ventilator over someone who had a diagnosis of diabetes or asthma? Should a pregnant woman get preference over a non-pregnant one? These discussions were ethical, as well as medical, and quite difficult to have. In primary care pediatrics, the decisions were not as challenging, but our staff was scared of getting COVID-19, and our patients were fearful of seeking medical care. To protect our patients from catching COVID-19, we changed our schedule to see healthy kids earlier in the day and sick kids later. We minimized the number of people coming into the office, we kept people out of the waiting room, and we disinfected our exam rooms and equipment between every patient. We started doing virtual visits, which are now part of our everyday practice. Sometimes we met families in the parking lot and we tested their kids while sitting in their parents' car. You can imagine the challenges that all of this entails. Just like our patients, our staff was scared. People were afraid that they might get COVID-19 and bring it home to their families. Some were worried that they might get COVID-19 and die. There is no record of exactly how many healthcare providers have died from COVID-19, but they estimate that in the US alone, about 3,000 doctors and nurses have died from COVID-19. We had to deal with shortages of personal protective equipment, and we found ourselves reusing gowns meant for single use, wearing the same mask day after day, and getting by with what was available. If we face these challenges here in the US, I can only imagine what it's like for doctors and nurses in developing countries. In pediatrics, we're fortunate that in general, children do not develop severe disease. That said, kids do develop a condition called multi-system inflammatory syndrome, and I've had patients get sick and get admitted to the hospital, with one patient spending 8 days in the pediatric ICU. Another family I care for had COVID-19 go through the home, and the mother, who was pregnant at the time, became very ill and was admitted to the ICU. Due to the severity of the mother's condition, they had to perform a cesarean section and deliver the baby at 30 weeks of gestation. Fortunately, both mother and child have done well and are now home. I'd like to turn now to how the COVID pandemic has touched me personally. My sister Christina died in February of this year from COVID-19. She'd been battling cancer, and during one of her hospital admissions, she was exposed to COVID-19. Her weakened body was unable to fight this virus, and she spent 10 days alone in an ICU bed. As her lung function deteriorated, her other organ systems started to fail. On February 17th, her husband Rafa and her son Adrian were allowed to visit her to say goodbye. 2 days later, she died. I could tell you many stories to show what a wonderful, kind, and caring person Christina was. She combined her passion for feminism with her interest in sociology, and she spent her life working to improve women's lives. She went through life putting others first, and she helped innumerable people. She lived in Madrid, Spain, where her activism and efforts helped to bring violence against women to the open in a culture where domestic violence was not discussed or acknowledged. Christina also worked with women being released from prison, helping them reintegrate into society. To paraphrase Hemingway, every person's life ends the same way. It's only the details of how you live that distinguish us from one another. Christina lived her life in a way that inspires me and challenges me to be a better person. Her death is a loss, not only to those of us who knew her, but to the countless others she had yet to help. I miss her terribly. As of today, COVID-19 has killed 3 million people worldwide, 570,000 in the United States and 77,000 in Spain. And these numbers are certain to have gone up by the time that you watch this video. Unfortunately, for many people, the pandemic went quickly from being a news story to personally knowing someone who was diagnosed with COVID, to having a loved one die from COVID-19. I know I'm not alone in my frustration at the fact that I could not visit my sister as she became more ill, that her husband and son could not be there when she died, that she had to die alone. It's easy to blame others for the severity of this pandemic, governments that did not respond as they should have, states that do not follow the recommendations of the CDC, and people who will not wear masks or who refuse vaccinations. Instead of focusing on blame and pointing fingers, I prefer to focus on what has gone well and what we've learned from this experience. The way that many of us have adapted to virtual work, virtual school, and virtual social encounters would have seemed far-fetched if you'd read about it in a novel 18 months ago. In some ways, life became simpler, slower, and while we all had to face challenging questions, they made us more thoughtful and helped us appreciate what we have and perhaps in some ways make us better people. Many have made a point of supporting local businesses to help them get through this difficult time. I've spoken to others who've expressed feeling grateful that they and their loved ones are healthy. People are spending more time doing things like biking and hiking. And not coincidentally, the air over our cities is cleaner and our oceans are less polluted. For over a year, we've spent more time at home with our immediate family, and hopefully not all of it in front of a screen. Personally, the outpouring of love that we have received following Christina's death has been a tremendous support. COVID-19 is far from over, and many challenges remain. Though half of adults in the US are vaccinated, in many countries such as Guatemala, Venezuela, Iraq, and Cameroon, less than 1% of people have received the vaccine. The pandemic presents a stark reminder of the contrast between those who have and those who have not. Putting my thoughts together to share my experience with you has given me the opportunity for reflection and introspection. And I thank you for your time.